Hi, good morning, everyone. Can you hear us? Oh, sure. Okay, so my name's Andy Zumber. I'm here with Allison Schuster at the HSCRC. We wanted to let you know that we are recording this webinar for people who aren't able to join us today. Right now, we have everyone everyone is muted. So if you want to ask a question, you would need to use the audio pin, and then I think raise your hand to let us know that we can unmute you. So we're going to just briefly go over the process that we went through to update the GBR infrastructure template for fiscal year 16, and then we're going to go through just kind of to show you how you would click through the updated reporting template so that you can submit the reports, which again are due at the end of September. So first of all, we want to thank everyone who reviewed our draft templates in the subgroup. We have incorporated many of the comments and updated many of the fields to best include reporting efficiencies and clarifications. So again, this is we took the language from the, I think this is from the initial purpose of the report from last year, and so we're just reiterating that these reports are going to include all population health investments. So we understand that it's a little bit challenging to say that these are investments that were made specifically with the GBR infrastructure dollars, so we're saying please include all population health investments. We are restricting them hopefully to investments that begin no earlier than fiscal year 2014, and we are including the same list of excluded expenses not to put on this report from last year, and that's all in the instructions. We wanted to note that there are three purposes of this report from an HSCRC standpoint. One is that it's a narrative of your population health investments and infrastructure expenditures. Second, we're pulling some financial data analysis kind of in the aggregate of all of the hospitals. And third, and kind of one of our most important focuses for this year, we're trying to better track outcomes and process metrics related to the investments that all of y'all are making. So our focus with the GBR infrastructure is to focus on care coordination investments, short-term reduction of potentially avoidable utilization, and building capacity to partner with community partners who in your communities, and then again, so that we can focus on the outcomes and metrics. Okay, so what we really worked on with the subgroup to improve the template for this year, we clarified and we tried to make the report a little bit easier, so you didn't have just some basic things. You didn't have to put in the hospital name in each investment tab, et cetera. Then we had a focused discussion on the categories of investments, because last time we were coding the categories on the reviewer end, and we'd like to give hospitals kind of broader latitude to do that on your end when you're inputting these. And then, as we mentioned before, we spent a lot of time working on how to best track outcomes, which we're still leaving a lot of leeway for you guys to pick, what best outcomes to track. And then we also wanted in this, I know I sent out that SurveyMonkey about the different current staffing, about care coordination and care transitions. We're trying to track that as well in the infrastructure report. There are two main new questions this time. One, we're going to begin to track a return on investment. And after a lot of discussion, it was agreed that we would track that by investment that you're reporting. And then we're also asking reporters to begin to consider the impact of these various investments on non-hospital service costs. Okay, so as we mentioned before, in the process metrics, these we have left these in the template, which we'll see in a minute, at general discretion for you to say, of this investment, here are one or two process metrics that that you're tracking to best to determine whether this investment is something that you want to continue, et cetera. But this is some feedback that we got from the commission that this is something that we really needed to better track. The other thing that we found is when we were reviewing the reports, a lot of times people would mention that several individual investments had an impact on reducing readmissions or increasing coordinated care, et cetera, but it was really hard to parse out the individual impact of each individual investment. So for the larger outcomes, as opposed to the process metrics, for the larger outcomes, we've rolled them up so you can discuss them in the aggregate. Okay, so we have sent, it was a little bit, maybe a week and a half late, but we did send out the reporting template, and I mentioned again that it's going to be due at the end of September, and we are trying to move the questions over so you can direct questions to me, Andy, instead of Allison. So I just wanted to reiterate that. Okay. Okay, so we're now showing the template to everyone, and this should open up to the directions page for everyone. And we're hopeful, so we sent out that Word document with the instructions. We're hopeful that everyone can have the instructions, handy while you're going through this, because it would be a little bit challenging to click through everything here. The instructions should have the category names as well as a sample, et cetera. So all of that information should be there for you. So the first thing that we would need to do is start with the Overview tab. So here you would just need to choose your CMS ID here, and it should auto-populate. So we can use Meredith. And you won't need to put anything in these white cells. They're going to calculate, they're going to roll up once you put in information there. So then the only other thing here, right, is that we would want you to put in the date, and then as well, we had a lot of feedback that on this narrative summary tab that it would be much easier if it functioned as a Word document. So we've embedded a Word document here. You just have to double click, and then it will function as a Word document. Okay. So we're going to go through how to fill out the individual investment tab, and then, but just really quickly, we've put 10 blank investments here. That was maybe an average of the number of investments that we received. But if you have more or less, if you have less, we would just ask you to please delete a couple of the rows that you don't use. But if you have more, then you would just need to, and we have this in the Directions tab again, but you would just need to create a copy and then rename this with the next sequential number.
Show them how the overview is.
Oh, sure. So we've coded this to calculate the total number of investments here. Okay. So moving here, the things that we have auto-populated would be the budget type that your hospital's on, the CMS ID, and the hospital number, as well as the investment number that we're working on. So here, I'm going to move this over. So again, we would ask everyone to please include a title for your investment. So this just as an example, we had a lot of people who were discussing their telemonitoring or remote patient monitoring investments at their hospitals. And then within the category here, we have a list, and you can see that list in the instructions. It's going to be on page 3 and 4 of the instructions. So we have here a table of the potential investment categories. And for this one, I focused on telemonitoring and telemedicine, but we heard a lot of feedback from people that you would want not to be restricted to just one category. So for most of these pull-down menus, we have please select the most relevant and then select other categories that may apply. Then we are also asking, excuse me, we're also asking for everyone to include a brief description of the investment, including the rationale for the investment and primary objectives. So here we're really hopeful that it can be 1 or 2 sentences and that anyone reviewing would understand, would be able to describe to someone else, to a third party, like what this investment is. And you can also see here that all of the green and blue tabs turn white once you fill them in, and we've left in column G, it's explaining if there are still things that need to be described. So once we include an investment here, once we include a description, it will turn white and the question for instructions will go away because you filled it out. Okay. So then we also are separating in our analysis the patient types that you're focused on. And again, we heard a lot of feedback that this could be a specific group or it could be multiple groups. So again, select the most relevant in any other category that applies. We also, I think that most of the investments are going to be all-payer investments, but there were some investments that were specifically targeting Medicare beneficiaries or Medicaid beneficiaries, so we've given you space to delineate that there. Okay. So then, again, we would want the total amount that you've invested in this, and then this question 8 is if this is partially grant funded, and I know some people have their MHCC grants for the telemonitoring. So if you're receiving any grants to defray some of the costs, please include that there. Next, we would have space for you to put in when the investment began, and we, again, are asking for investments that began in fiscal 14 or later.
Can you show what it's 13?
So if you had done something earlier, it will bring up a reminder notification, and you can leave it earlier. It's just we're going to note that, and we understand that some of these investments are ongoing investments that you've expanded since fiscal 14. You can just include that in our kind of catch-all additional comments section at the bottom. So it's not going to restrict you from that, but we are focusing on investments fiscal 14 or later. Okay. Question 10. This is the information that we pulled that we were requesting in the SurveyMonkey, which was kind of complicated, and I'm grateful to everyone who was working on that to pull staffing in the aggregate. So this will sum up in 10A automatically for you, and so you can just pull. I think HSCRC is really interested to learn more about kind of the different positions that are working on these care coordination initiatives and population health initiatives. So that is there, and just to show you, to demonstrate that it will sum. Okay. So another bit of feedback that we had from last year is that there's a broad push to use these infrastructure dollars to really partner with the community. We had 2 categories last year, and it was a little bit confusing what we were looking for, so we've changed it this year to be clinical partners and non-clinical partners. And again, as with all of the drop-downs, we've left space for you to include up to 3 categories with a delineation for which category is the most relevant. And these are required questions, as you can tell by column G still being open. But if this is truly a hospital-owned initiative and it's internal to the hospital, then you would just have to select that there are I mean, none is an option if you're not partnering outside the hospital, which is fine. We understand that. And then if you're saying other, please just specify the other here in this blue category. So now the process metrics, as we mentioned in the slides, this we're leaving a kind of broad latitude for people to choose the metrics, and we've left space for 2 process metrics, but we're only requiring 1. But this would just be internal to the hospital when you're deciding whether, in this case, your telemonitoring initiative is paying dividends to the hospital, you know, is a worthwhile investment that you want to continue. We're just wondering, you know, how are you tracking that? And so in the example that I included in the instructions, I said our process metric would be how many people are enrolled in the remote patient monitoring pilot. So, and I have I've broken out a couple of other examples in the instructions page, but you can see that we're only requiring 1 of the metric series to be completed here. So in this, we were saying the number of patients. And then we want to know just a 1-sentence explanation of why you included this metric. And then we would just want a time frame of this so we can understand better understand the data. Okay, so then this would be the total number of patients. In this example, this would be the total number of patients that you had in the pilot. The denominator here would be the total number of potential patients. This next one is your goal of how many patients you were trying to get enrolled, and then this last one is how many you actually got enrolled. So I've left several examples in the instructions tab. I understand this is, again, this is broad latitude, so how you're defining it. And we did go back and forth a lot on trying to make the definition a little bit clearer, but we really wanted to give people broad latitude to pick the metric that was most meaningful to your specific investments. It's really hard to kind of, I mean, the investments really are a broad spectrum of population health investments. So that's why we left this a little bit with more latitude this year. Okay. So next, in 14, as I mentioned, we're going to look at broader outcomes, larger outcomes in the aggregate. So this we would say, please, so we're asking you to say, out of all of the outcomes, please tell us which outcomes would be impacted by this. So in this example, we said CHF telemonitoring will hopefully reduce readmissions as well as ED visits. There's space over here in outcome metrics analysis for a broader aggregate analysis, which we'll talk about in 1 second. All right. So then now we're at our new questions for this year. The first is that we're asking for an estimated return on investment for fiscal year 16. I think many of you are familiar with the ROI calculation tab that we've included again in the instructions. This is the same from the transformation implementation grants. This is the same form, and this is something that we're beginning to track. And again, we're not expecting people to have a positive ROI, but we are expecting that you as hospitals are looking at whether this investment is generating a return on investment and whether it's generating savings, and that you're tracking that internally, and so that's why we've included it here. We had a lot of feedback that while that would be ideal on a by investment level, there are some investments that it's just really hard to calculate it for. If you can't calculate it, please just briefly give us one sentence about why it can't be calculated. But know that we're introducing this ROI question this year, so hopefully we're going to refine it in future years, much like the process metric. So you would just include here, if it's the first year, maybe it doesn't have very much of an ROI, but it may be increasing in future years. Okay, our final new question for this year is the impact on non-hospital service costs. And many of you have been hearing us discussing this at commission meetings or in other work group meetings, but we are looking at both the all-payer costs and the costs outside of the hospital. And we're looking at this on the infrastructure reports in a very broad sense. So this year we are just asking whether you think this will likely increase, decrease, or have no impact on the non-hospital services. And then if it's impossible to tell, we do have an unclear at this time option. So we could say this will likely increase non-hospital service costs slightly. And then, again, I've left this additional comment section here if you wanted to clarify any of the statements. We really have lots to form to follow the drop-downs, and so this additional comments is if you wanted to clarify anything that you've put in there. Again, this is so much information that we're not going to be penalizing anybody for any individual line item. So this is really an aggregate, but in case there was anything that you wanted to clarify, we have space in the additional comment section. And now you'll see up here in G1, this had been red the whole time. It's red in this next one over here. And now that we've filled out the entire tab, it will just say that you've filled out all the information that we were hoping that you would fill out for this investment. So then the last thing that we will mention before we take questions is the...
So again, Andy, if you only had, let's say, in the hypothetical situation, one investment, you would then just highlight the others and delete them?
Oh, sure. So, yeah. So let's say you have 6 investments, then you can just highlight the rest here, delete these additional sheets, and then if you go back to the overview, you'll see that now there's 6 sheets. And the total investment right here is summing just our one total, because we only put in one. Okay. So then in the aggregate over here, so you'll remember in the investment that we input, we said it was going to impact readmissions as well as emergency department visits. So we would fill out the metric series for those two. And in these, grab my notes here on this one. In these, we are pulling, we mentioned before, we're trying to just give you space to say how the overall population health investments you're making are impacting readmissions more generally. A lot of times we would read the same paragraph about this is what your readmissions were and this is what they are now, and that would be in any investment that was connected to readmissions. And we just don't want to make you rewrite it all these different times or copy and paste it. So, and I included this is Appendix B, is the sample outcome metrics analysis. So you would put, again, the measurement time period, and you can see here too that it just pops up a brief message note letting you know that we wanted this to go the whole way. You fill out the entire outcome metric series the whole way across. So then the target maybe, and maybe this aligns with your goal for the RRIP or whatever, but your target outcome to be reduction in readmission the year specified, and then the observed amount maybe was greater. And then here in this column G, we would say that just the numbers of the investments that probably impacted it. So we definitely would say our investment 1. But as you're going across and you have multiple investments, you can put them in here. 1, 4, and 6 impacted, total number of readmissions, etc. And then here we've left space for discussion. And you can see on, I'm not going to type that whole paragraph up, but you can see on page 9 in Appendix B of the instructions that you could have a broader discussion when, and kind of say this is how you're tracking readmissions with the population health investments that you're making. Okay, so I think that's all that we have to present here. I did want to mention the totals tab is just going to take it's really at this, in future years, hopefully we can make it a little bit bigger, but right now it's just going to take in total the financials that you've input in the tabs that you have. And the drop-down page is all locked down. This is just so that it's feeding all of the drop-downs in the individual investment tab. But you can see all of the categories on this page. We're hopeful that you can just, it'll be easier to just see them in the instructions where we've included definitions, but we just wanted you to know that it's there.
Okay, great. So I think now we'll open it up again. If you would like to ask a question, could you please raise your hand and we will unmute you. Wonderful. There appears to be no questions thus far. Well, while I give people a chance to raise their hand again, I do think, I do appreciate, Andy, all of your hard work on redeveloping this form, and I do think that this represents an incremental improvement on what we had. And again, the subgroup has been very helpful in advising us on ways, as well as MHA and others from DHMH. So we do appreciate all of that. We also know a lot of different people at these organizations will be the ones completing these forms. Again, this webinar is recorded, and we will post a link to it on our website. So I'm not seeing anybody raise their hand, so Andy, that means you were crystal clear.
And we mentioned when we sent out the template, etc. But I have, you can email me or you can call me as you're filling it out if you have additional questions.
Great. All right, Mary Hannah, I'm unmuting you. Hi, Mary.
The question that we have that we couldn't quite hear in the beginning, the due date, did you say the end of September?
It's 3 months after the end of the fiscal year, so September 30th.
In the state fiscal year, yep.
Thank you.
You're welcome. Other questions? We'll stay on for another 2 minutes, but I'm sure everybody can use your time. You're also welcome to email questions. I think we had discussed, and maybe we'll do this, we had discussed doing a frequently asked questions page.
Oh, yeah.
So we'll do that. That was similar to how the RFPs went. So as we get questions, we'll post the question and the answers on that and make sure that's clearly on our website so that before you ask a question, if you want to check there to see if it's already been answered, or that way you can also maybe clarify your question if you wanted, before we repeat answering it multiple times. Okay, wait, we have one more question again from Mary, or maybe you're still, I didn't undo your hand.
Well, I do have another question, so
Great.
good timing.
I wanted to ask, is this going to take the place of that Survey Monkey that we did complete to post our FTE positions?
Yeah, that was a one-time request from leadership here, and I have the results of that for them. But on an kind of moving forward, they just wanted to incorporate that
into this form. So yes.
Great, thank you.
All right, we have another question from Brian Sims at MHA. I've unmuted you.
Hey guys, so I just wanted to ask about the transformation grant awards. I know the final decision on those will be made in the June meeting, but I talked to Steve Ports last week after the meeting about the structure of the report that hospitals who do accept the awards are going to be asked to submit. And I was wondering if there is going to be any tie-in with this report template to those report submissions. I don't know if there's been any conversation on what that report would look like. I don't know if it would be similar to this or not. But has there been any conversation on that? And would it be similar to this, or would it? Yeah. I'm sorry?
Steve is actually on.
Oh.
So I was.
Okay.
He joined us. Steve, are you there?
Yes. Can you hear me?
Yeah. So would it be a totally separate process? I guess as I look at this report, I was just wondering if there was any thought that maybe those two submissions would be somehow tied in together.
Yeah, Brian, we had some general conversations about that, and I think what we may want to do, and don't tie us down to this yet, but to make it as easy as possible for the hospitals, we think that there are perhaps elements in this report, many elements in this report, want also for those initiatives that are being approved through the implementation grants. So for an annual report, we could either have an addendum to this, which again looks, potentially very similar to this, to make it less burdensome on the hospitals. But we would also want some interim reports that would not be quite as robust as this, just so that we're getting updates on how are the projects going, how's the ROI. We also have a legislative requirement for, I believe, December. So we're going to need on behavioral health stuff. So for those implementation grants that have behavioral health elements, I think we're going to need something in the first few months just to see how things are set.
Right. Okay. Thanks.
Okay. Thank you, Brian. Are there other questions? Steve, do you have anything to add?
No, I don't. I want to thank Brian and the hospitals and all the other stakeholders for taking a look at this process. It's been informative. Obviously, the whole goal and the interest of hospitals and others is to gradually move toward, better health, better population health, because one, it's in the best interest of patients, but it's also under the global budgets in the best interest of the hospitals. And so we look forward to working with you toward that goal.
Great. Well, thanks everyone for joining us. And again, if you have questions, please direct them to me, Andy, instead of Allison. And I've left my phone number and email address on all of our memos, etc.
Wonderful. We will be signing off. Thank you.
Thank you.